webcast, Meditech MPM 101. My name is Sue D'Agostino. I'm a registered nurse and senior clinical consultant. I've been with Galen for almost 4 years now. My colleague, Kim Baxter, is also a senior consultant with Galen, and Kim has been with Galen for 5 years. We have some really great content for you today that we hope will give you a clearer concept of Meditech MPM clinical and non-clinical workflows, as well as some Meditech MPM background. Just a few housekeeping items to get out of the way before we get started. Your phone has been muted, and we do encourage you to please use the Q&A panel to ask questions during the presentation. We'll try and answer a few questions at the end of today's webcast. However, all questions and answers, along with the slides from today's presentation, will be posted on the Galen Wiki within a few days. Also, please note that you can click the arrows icon to view the presentation in full screen mode. Now, with that out of the way, let's get started. On our agenda for today, we'll go over a brief introduction to Meditech and MPM. We'll discuss the bonus of interoperability between the inpatient EHR and the outpatient EHR. We'll also review the patient visit from check-in to check-out, including some tips and best practice along the way. A little background information on Meditech and MPM for those of you who are either new to Meditech or just may not have had this information. Also known as Medical Information Technology, Inc., Meditech was founded back in 1969. It's a Massachusetts-based medical software and service company. The organizations they serve include physician practices, ambulatory care centers, acute care hospitals, long-term care facilities, and home health. Meditech customers are located in several different countries, with most customers located in the United States, Canada, and the United Kingdom. And as you can imagine, Meditech offers many types of software, including health information management, revenue cycle, emergency department management, data repository, patient discharge instructions, home health, long-term care solutions, the list goes on. Back in 2000 and 2001, Meditech invested in LSS Data Systems, and in February 2011 acquired complete ownership. In 2000, both the practice management products and ambulatory EMR were incorporated into a suite of applications for physician practices called the Medical and Practice Management Suite, what we fondly call MPM. In addition to LSS's physician billing, practice management application, and electronic ambulatory records, the suite meshes together applications jointly developed with Meditech, including scheduling, order management, scanning, and a web-based patient portal. Today we'll be focusing mainly on NPM. One other thing, similar to other EHRs, Meditech also has a user group. MUSE, which is the Medical User Software Exchange, is the largest independent Meditech user group that provides networking, education, and training for Meditech organizations. The MUSE website can be found at www.museweb.org. A brief review on interoperability between the Meditech outpatient and inpatient EHRs. To access the inpatient record from the outpatient chart, the user only needs to select the Other Chart button from within the table of contents. This opens up the inpatient chart. One thing to remember, a user does need to be granted access to the inpatient record to use this functionality. Someone who has not been granted access will quickly find out when they click that Other Chart button, they will get a pop-up telling them, hey, you don't have access. Easily resolved by contacting your system admin or system analyst who can get that set up for you. Another thing of note with the Other Chart accessibility, some organizations will only allow their providers to have that access, so you would want to check with your organization on their policies. So depending on what type of inpatient encounters have occurred, we can review all available patient information in the inpatient chart, including orders, results, documentation, vital signs, even that patient's input and output if it's been documented. This functionality provides physicians with the ability to easily obtain patient information without having to go in and out of separate systems, or even more time-consuming, having support staff call the hospital to have the information faxed to the office. Next, we're going to go through an outpatient office encounter. We're going to start at the very beginning with the scheduling of appointments and the navigation of the scheduler's desktop. We'll head into check-in and go through intake and the physician exam, and then we'll finish up with checkout. I'm going to hand things over to Kim to begin our process. So please bear with me for just a moment as I assign her the presenter privileges.
Thank you, everybody. Happy Friday afternoon. Let me get to my screen here. There we go. Sorry about that. So we've got a lot of stuff to talk about today, so I'm going to quickly go through where your appointments start, which is in the scheduler workflow. So to start off, we're going to look at where you would register the patient, schedule them, and change their status is what we're trying to ultimately get to start that, kick that appointment off. So from the NPM menu called Administrative, we will go to the Scheduling Database and the NPM Scheduler Desktop. That will bring you into a screen such as this one. What we're viewing here is the patient view. This allows you to search for a patient by name. It will then give you a list of the patient's appointments, past or present or future. Once you highlight the appointments you're looking for, then you will see they've got a kind of a summary of the patient right here. You've got demographics, appointment information, the account insurance for this appointment, and the resource for this appointment. So this will let you kind of, patient standing in front of you, quickly review that information, and if there's any changes, you know you need to get an update. The very bottom of each page that we'll show you, there are a list of functions, and those are called the footer buttons. The footer buttons are action items for whatever screen you're on. So let's take a quick look at what's on this screen. These footer buttons will also carry over in some of the other screens. When we get to a screen that's different, I'll point that out to you. So first of all, we're going to look at display. So the display allows you to make a change to the date range, the appointment status, the resource, the appointment type, the registration status, if it's a temporary registration versus a full. So you can manipulate what you're seeing here based off of this display settings. Then you have letters and forms. Letters and forms allows you to print. You can queue or spool up or even delete letters that are pending on a patient. And these can be patient-specific or these can be batched by a group. So if you want to send out all your new patient letters for everybody for the next week, you can spool those up and do that from this screen. Changing the status, this is ultimately what we want to do to kick off our appointment. And in a little bit, once I show you all the areas that we can change the status, we're going to talk about what the status options are. Then we have duplicate. So duplicate means that you can take whatever highlighted appointment you have in front of you and actually duplicate it somewhere else, either a different provider or whatever. What it will carry with it is the same appointment type and the visit reason and the resource. So if you're going to change the provider, then you need to just do what's next, which is the follow-up. That will allow you to create a follow-up appointment for the highlighted patient or scenario, but you can change the appointment type and you can change the resource. Then you have times. Now, times is kind of misleading here. You would think you'd want to look at open times. That's what a lot of systems, when you click on times, is going to show you. But not in this instance. In this instance, what it's going to do is kick off a recording of all the status changes for this appointment on this patient, starting with this status change. So once you click the patient has arrived and you click on the times, or you click on the times and then they arrive, it'll start doing a time tracking for this patient's visit from beginning to end. Now, this will only work and be accurate if everybody within this patient visit participates properly in the workflow. Otherwise, it's not going to give you a good count of how long the patient had to sit in the waiting room, how long it took the nurse to do their intake, how long the provider took before they discharged the patient. So that's what this is for. It's a great tool. I know a lot of systems don't have this, so this is a great tool. Alerts, just what it means. There are certain alerts that you can put on the patient, certain places you can add alerts, but there are only certain areas within the chart and within your routines or workflows that you will be able to view these alerts. So if you're going to utilize your alerts, test them, make sure they're what you want and you're going to be seen where you want them to be seen. Then we have self-maintenance. So this is exactly also what it means. This launches you into the patient's health maintenance and disease management record. How many times, if you're in a front office, do you get a call, you know, when did I come in for my last blood sugar test? I need to come back, and I don't remember when it was. If you have this patient enrolled in their diabetes health maintenance or diabetes disease management, you can quickly go here, look and see when their last test was done without scanning through a bunch of stuff, and give the patient the information they need. Future appointments. If you only want to see future appointments on this patient, that's what that button will allow you to do. It will also show you anything that was scheduled through a task or order management. It will have that on here also. And then you've got your request eligibility. Not only does this check the patient's insurance eligibility, but it also checks their RX eligibility or benefit plan management. This is for an ad hoc test, so if you have a routine set up to where it runs every night at midnight and tests everybody on the schedule for the next day or 2 days later, and this patient has been added since that has ran, you can run an ad hoc eligibility check and get the information that you need. The review eligibility will show you the last status of eligibility that was run on this patient. Okay, the next menu item down is the practice menu. What this is showing you is a particular practice. So if you do scheduling for multiple practices or sites, I guess you could use that too, you can narrow this down by site doing this function. And you can even do, as you see here, I've got a group of dates versus one particular date. And it also gives you all of the types. It also gives you all of the resources or providers. So that's very helpful if you're looking at it by the group. If I have a patient highlighted up here, then in this box I've got circled in red down here, it would give me the visit reason for that line item, and it gives me if the appointment has been confirmed or not, and any visit comments that I want to put here. And again, we have the footer buttons. Now, there's not a lot of change here, but there is one change. If you notice, there's a quick find. What this does is it lets you pinpoint a patient on the day schedule. So if you have a ton of patients and you want to, instead of scrolling down through here, you can do a quick find and pull up the patient's date or name or date of birth, and it'll zero in on that patient for you. Another thing is that some of these columns, like the date column here, if you've got a group of dates, is you can resort by that, by clicking on the header. And I do want to point out, we are using the MPM 6.0 for this test system. So if you are not seeing, if something looks different than what you're used to seeing, it might be because we're using a different version than you are. So keep that in mind. Also, depending on some of the, this is a lot of customization can be done to this, so you might have something customized a little bit different than this test system we're using, so keep that in mind. This third option we have is an appointment book. If you like going back to the old school ways and having that appointment book in front of you with your times down the left side and your doctors all across the top, this view is for you. You can look at this by resource group. So when your analysts are doing their build, you can pick people by their role or their site they're going to work at and give them a default resource group. And that way, whenever you go to this screen, it automatically defaults the providers that you're supposed to be viewing. So this particular site has multiple providers, as you can tell. But that's good. We're going to go over some of the fun things about this view. Again, our footer buttons down here at the bottom, if you notice, these are different than the other screens. So let's run through these real quickly. We've got daily and weekly. Exactly what you see is what it means. You can move forward or look at this as a daily view or a weekly view. However, I'd hate to see it as a weekly view if you have 10 providers like this site does. Previous or next, you can go to the previous day or week, or the next day or the week. And then the go-to dates. If you click on this, it gives you can click on a little calendar and you can go to a specific date. Quick find again. You through all this cluster, if you want to zero in on somebody quickly, use your quick find button. And now look at this. We've got a cut, copy, and paste. Cut, copy, and paste. So that means that you can highlight a patient. So if we highlighted Haley Test and clicked cut or copy, it would take exactly what that patient has and let you paste it somewhere else. Now, I want to give you a little word of caution with this functionality. What I have seen before is somebody took this patient, provider got home from surgery, was going to be late, they wanted mid-level to see the patient, so they took this patient, cut them, and pasted them in the mid-level schedule. However, when the mid-level went to place their orders and do their documentation, they couldn't sign it off. They couldn't sign off on it. They couldn't put their PIN in to verify all that because it was still linked to that original provider's encounter and as the owner of the original provider that was scheduled. So give you a little heads up on that. Then we have our change status again here. So this is another area we can change our status of this appointment. We can transfer. Now, the scenario I just gave you, it would be better for them to transfer because then they can change the resource that's owned for this encounter. So that would be an option for here. Then we have temporary resource group. If you borrow personnel from site to site to cover and have a float pool, and you have been given a default resource group like I talked about, you go to another site, you can change your resource group here temporarily. And then when you sign out or if you get timed out or whatever, the next time you log back in, it'll default back to your default resource group. So that's kind of a good little trick here that kind of helps you along a little bit. Now, you notice the color coding. So let's look at that real quick. We've got overbooked. So over here, the pink, you see we have multiple. That means for that time slot for that provider, there is more than one patient booked in that spot. So that spot is overbooked. We have a light gray. That means that is booked. Wait list, that means the patient's been taken from the wait list and put in the schedule. This site is not using that functionality, so we don't have one. Unavailable, you can see this says blocked. So that means that slot is not available to be scheduled. Won't let you. The light green, as you can see around here, means that there's no time scheduled. It's unblocked, but there's nothing defined for that area. And then we have profile exists. That means that only a particular type of appointment or procedure, something of that sort, can be scheduled in that slot. A profile for that time exists. Maybe that's the only time they'll see new patients. That's the only time they'll do physicals. So you have to know within your policy of your clinic what that profile is, but that just lets you know but that's a designated appointment time to kind of alert you before you put someone in there. This aqua color or light blue means it's available for another group. So this provider goes to a satellite office half a day, once a week, and maybe you schedule for both sites. This will allow you to quickly identify when that provider is at that satellite office and allows you to put a patient on that schedule. The dark green is selected spot, so if I was going to schedule a patient in here, that just means I've got that highlighted and that's the spot that I'm going to select. And then the white just means it's an open schedule, there's certain things designated, but not, you know, it's not in stone. It's available. You can book. Up at the top here, what I like is that you've got your providers at the top, and then underneath here you've got, in brackets, the number of appointments that are scheduled, and then the percentage of full. So according to what your normal daily routine is in the white, whatever's booked, it will tell you. So that helps if you've got work-ins you're trying to help get in and things like that. Your policy is, you know, the least scheduled provider gets the work-ins for the day, then you can quickly look and see who you're going to schedule that patient with. Then the next option is resource. We're not going to go over much on that, as you notice. It's a very busy screen. It's looking at a particular provider or service and letting you know by a month at a glance how full it is. It's like a speedometer. It'll slowly go, a graph will go further and further, like on the 24th here. As the schedule gets full, that'll shade more fuller and fuller and fuller until it gets full. You can see what the patients are, like I have here, demographics and schedule, and then you've got previous month, next month, and so forth here. This particular screen, you cannot change the patient status, so that's why we're not going to deal much with that. So the other place you can change status on the patient is from the clinical side, from the physician desktop. So from the MPM menu, you click on Clinical, and Application Database, Provider Workload Management, or PWM, and then your physician desktop. You will be taken to a screen that's called your desktop. Now, what I've done is went ahead and selected the patient schedule, which is the second option down. And this is what your schedule would look like. Now, this is a provider's view, and the nurse's view will look the same. However, unlike the scheduler desktop where you have a resource group, you'll have to click Cover Selections and click OK to bring your provider schedule in. So here we have footer buttons, and down here, as you notice, it says Schedule Appointment. This will take you right back to that scheduler desktop that we were looking at earlier. Then there's one other place that we can get to change the status and schedule an appointment, and that is within the patient's chart. So I have Paula Test in context. I've got her chart open, and I come down here to Administrative. That opens a window with different routines and reports. You can see there's several different things here under Routines. One of the things is Schedule Appointment. Again, you click on that, click Process, and it takes you into the scheduler desktop. But what our main focus here is to change the status. So all of this information is to change the status. So from the scheduler desktop, you've got to think about this as this is where everything starts. So for instance, our David Test appointment is in a booked status, and we want to change them to the next level. When we click on Change Status, we're given canceled, no-show, and attended. You're not given anything else because from a registration point, that's the only things you need to be worried about. Are they canceled, no-showed, or attended? So we're going to change this status to attended and show that the patient has been arrived. From the provider desktop schedule that we were looking at, this kicks off the clinical portion of the visit. You're given a lot more options here because this starts off that clinical portion, and we all know there can be different statuses throughout that patient visit in the back end. So here you double-click on the status column with your highlighted patient, and you're given a status box. We have arrived. That'll automatically do these defaulted for you here. We have roomed. That just means that the nurse has taken the patient and put them in the room. And what I recommend for best practice here is once you put them in a room is to come down and put in your comments what room you put them in. Once the nurse has done the intake and prepped the patient for the visit, then they change it to NC, which means nurse cleared. That lets the doctor know, hey, that patient's ready for me. Some systems, and I have seen this, where they can set an alert once that patient has been flipped to that nurse cleared. A pop-up will come up on the provider's screen if he's logged in somewhere or she's logged in somewhere that says patient so-and-so is ready for you, is nurse cleared, or I forget what the exact message is. But that is an option, a preference that you can set, and that's pretty neat. Then we have seen, which means that the provider has finished with the patient and they've seen him and they've changed that status to seen. Then we have departed. So what's the difference? Seen means the provider is done. That does not mean the patient's ready to go. There might be an order for an injection. There might be an order for an EKG, lab work, radiology, anything of the above. So if the provider has not taken the patient out of the room, they're still in the room, but they've changed it to seen, that's a good cue that your nursing staff needs to look and see if they've been given a task to do something on the patient before they check out. Then once the patient has been completely taken care of and been seen, then we're moved to departed. And at the very end of this, I'll show you a couple other places that we can depart the patient besides here. Then we have comment only. If you just need to put a comment in here for something, then you can click on that comment only and it won't take out what you've done, change the status. It'll just let you update that comment. So now we're going to start our visit. The nurse has roomed the patient and they're ready to do their intake. They go to the provider's schedule and they click on the little pencil. This brings up a box to look up a note template. Depending on how you're set up and how you utilize the templates that are delivered, or if you build your own, you can have favorite templates. So that narrows down which ones that a particular site. So as you can see, this system is split out by specialty. Or you can click on the All button and go through all of them. And you can type in an intuitive search here to kind of pull up what comes up from that. This instance, we're going to use the cardiology note template. When we click on that, then it takes us into our intake section. I lovingly call these little sections up here that I've got highlighted is my bubbles. To me, they look more like bubbles than sections. So anyway, this is our intake bubble. And it starts off with your chief complaint. This is a text field in this instance, but you can also, let's say you're a pretty narrow specialty and you only see patients for a particular list of problems, then you can actually do a query and have separate responses in here where they can just click on that, the response versus free texting. The next field you see is additional comments. That brings up a document editor, almost like a WordPad, for you to free text in or dictate. You can dictate in any of these also of comments or complaints. So if you have your dedicated list and then they have extra things they want to talk about, you can do a combination of both. Then we have our allergies section. When you click on edit here, it brings you into a more robust area for allergies. That allows you to also put the type of allergy. Is it an allergy or adverse reaction? Is it what the severity is? Have we verified this? Any additional comments? And if you notice here right underneath, you can put the symptoms that happen whenever this, they get short of breath, they have anaphylaxis, hives, whatever. Then you have your vitals. Now, starting here on down, a little further down, when you launch an edit for these, it takes you over here to this side toolbar or menu. And as you see, you've got your med list, problem list, history, and vitals. So when you click on the edit button on these, it takes you over here to this menu. We also have the pain scale, and we have the med list. I like this because instead of going into the big med list, you can quickly review the patient's meds with them, and if everything looks good, you can reconcile it right here. If there's a change, you click edit, it launches the med list window, and then you can make your changes and adjustments. We have tobacco use here for the intake. This is our social section, or any other additional questions that you want to ask to satisfy all those meaningful use and quality measures. And then you can add anything down at the bottom that you like. Next, we're going to look at our social, family, and personal past history section, or bubble, as I so dearly love to call it. As you can see from the main screen, when you click on this first bubble, you don't see anything. It's just hyperlinked. What that does is, again, it launches you back to this section of the menu on the right. However, when you launch this, it brings up this whole window, and then you have a subset section here that you can quickly run through. And you've got a summary that you can just review it real quickly. As you go through each section, there is a reviewed button here. And then once you're done, all of these will be checked, and you can come back here then and click Update Selected Sections as Reviewed. Now, this is the desktop that we talked about. When you first log in to the clinical desktop and provider desktop, this is where you're taken. This is like your work list, task list, your messages, any of those things are given here. And you can change what you see by doing cover selection. So if you're covering for a different provider that day, you can pick that provider and uncheck your provider, and it'll bring you up anything pertaining to that particular provider. So that's really nice and makes it really versatile for floating your staff and decluttering some of that. But here, what I want to look at is, I'm sorry, Sue, this is your section, and I'm just taking off with it. Sorry about that.
That's really good. I was just watching you, applauding you going along, girl.
I was just going to keep on going. Okay, I'm going to turn it back to you now.
All right. Let me share my screen so everyone can more or less see what you were looking at, what Kim was showing y'all. All right, y'all should be able to see the desktop that Kim was just showing you, which again, she was doing a great job with. And actually, it actually helps things out a little bit, because before I got into the physician workflow, I did want to discuss the physician desktop a little bit, because this is kind of a big place, an important place that the physician needs to be starting their day in. The desktop is the first thing the provider sees when they log into NPM. And it is, as Kim mentioned, their task list. Any patient messages, results, incomplete documents, prescription renewals, and so on are going to show up here on their desktop. Another thing I want to mention that they'll also see is something that's called a watch list. The watch list is actually comprised of the support staff tasks, that are associated with the physician by either the appointment, a patient appointment, where there may have been some system-generated tasks based on that appointment, or it could just be a message that the physician has responded back to their nurse in regards to. All of those type of tasks would be found here in the physician watch list. Makes physicians anxious a little bit sometimes because that number can sometimes be 50, 60, 70 tasks. And most doctors I know, and nurse practitioners for that matter, like to try and keep their task list clean as much as possible. So the watch list can sometimes get a little tricky for them, but just emphasize that they do not need to look in there unless they really want to. And then in general, when training your providers in regards to the desktop and the task list, best practice, just emphasize with them monitoring throughout the day. Most importantly, first thing at the end of the day to make sure that nothing falls through the cracks. Some other actions that can be performed from the desktop include preferences, return to all tasks, cover selections, and cover, which Kim did mention, the cover selections and cover. I'm going to briefly go over preferences and return to all tasks, because I've not seen them used routinely in clinics as much as the cover and cover selections. Preferences, that's just used to access the provider workload management preference dictionary. From there, the user can edit their desktop preferences. Most often, the preferences are done on the back end by your system analyst or your system admin, and the docs don't really need to go in there and do that unless it's something that they really want to do. Return to all tasks, that is for when a user is on a find patient list of individual patient tasks. The return to all tasks button will return the user back to the desktop task. The only time that button is available is when you're going through that process, otherwise it's unavailable. Now onto the coverage stuff that Kim had mentioned. When a provider wishes to see the tasks of a user that they are covering, they click that cover button. Cover selections is what allows the provider to actually select the provider that they wish to cover or monitor tasks for. By clicking that coverage selection button, it opens the coverage selection window so that the provider can select their coverage user or group. As you can see, the provider has the ability to select provider groups, work groups, or just an individual provider that they wish to cover. Some docs will cover for each other when they're on vacation or just unplanned or planned time off, and they can use this functionality to do that by typing in a couple of letters of either the provider's last name or work group name, whichever they need to be searching for. That will bring up the name of the user or group they're searching. They click on the name that they wish, because Smith is usually a much more popular name, and there would normally be more than one, and then they click OK. So pretty easy for your coverage selection stuff. In addition to the tasks on the desktop, another tasking workflow is signing off on orders. Many organizations have their system set so that any orders entered by support staff need to be signed off by the physician. Clicking on the sign button will allow the provider to sign orders and reports or notes that are in a status of unsigned. When they click that sign button, the sign documents window will pop up, and the provider can filter by orders, reports, which are notes, or all. They can also filter by date, name, or document. For Process X, I'm going to explain the different ways of getting the process going. Process X, the provider would click on the box next to the patient items they wish to work on by clicking in that first column. This process puts a red X next to each item selected. Then the provider would click the Process X button to begin their signing. A couple of examples why this workflow might be used. One, a provider may just have a little bit of time in between patients. Their task list is all clean and they just want to start getting some of their signing done. So they just click next to a few names and they can process X. Or say a particular patient has some orders that need to be signed off on that are kind of stat. The patient's at the hospital and this order needs to be signed off on, or whatever the situation may be. The Process All button allows the provider to process all items that are in need of signature. Process orders will, of course, process orders only. And again, using the process X would allow the provider to sign off on only the items that have been selected. What we have here is an example of a referral order. To sign, the provider just needs to click on the pen icon. This will bring them to the next order that needs signature. If they needed to stop the process at any time, they can click on the stop sign icon. Once they've either finished clicking the pen for all orders or click the stop button, the system will then alert them to how many items are queued for signature. They can then click the sign button and the electronic signature window will open. The provider enters their PIN, clicks OK, and then they'll be brought back to their desktop. And this brings us back to our schedule to begin our patient visit workflow. From here, the provider clicks on the patient to bring into context. Once the patient is in contact, as you can see, the patient name and information for visit is highlighted a different shade than the other patient encounters. The chart buttons will also be available to select. To open the chart, we can either select the magnifying glass or click on the Open Chart button, which is the first button in the lower corner. To go straight into the notes that our nurse has opened, we could click on the pencil icon. If the provider wants a quick review of the patient prior to going to the note, when they open the chart, they're brought to the patient summary. The patient summary is like a snapshot of all patient information. In the summary, you'll find visit history, problems, meds, immunizations. For your PD patients, you'd find growth charts, as well as health maintenance items. To prepare for the visit, the physician can navigate through the patient chart to review previous practice notes, labs, problems, and any other relevant clinical information. If we needed to go back to the schedule, we could select Record List. To begin our documentation, however, we'll click on the Document button. We're now at the document that was opened by our support staff with the necessary intake information entered. We can review the intake performed by our nurse, or we can select the Edit Amend button to begin documenting. We can also select a blue hyperlink that will bring us right into that particular note section. We do have the ability to scroll through the note in the event we wanted to, say, jump right into that physical exam section. We could just click on the physical exam hyperlink and be able to access that note section from there. And while we are here, this format that you're seeing here is the actual visit note, how it's presented within the patient chart. All right, so we've clicked on our hyperlink or we've clicked on Edit Amend, and this brings us into our template or note documentation workspace. The bubbles, as Kim so lovingly calls them, at the top of your template will indicate the note sections of the template. The section bubble that you're documenting in will always be white. Normals allow us to add normals to the review of systems and physical exam sections of our note template, and the provider can then go back and document by exception. An example of document by exception for any of who are unfamiliar with that would be, say, the provider documenting in the physical exam constitutional section, and their normal for that is well-developed, well-nourished, and in no acute distress. Now, as you can see here today, our patients here for abdominal pain, fever, and sore throat. So I'm guessing they might be having a little bit of distress today. So once the provider had placed their normal, they could then go back and either change in no acute distress to in acute distress, or just they could remove it completely. We also can add or remove a section. This functionality could be used if the provider wishes to use a different physical exam than the one that came with the template. They just would need to add a new physical section that they did not. Clear responses, pretty self-explanatory. This will clear out any responses that have been documented in that section. View protocols. Protocols are clinical treatment plans that are associated with documents. In order for the View Protocol footer button to be activated, the protocols must be attached to the template via the Ambulatory MIS Physician Documentation Template Dictionary. Preview. This allows the provider to see what the actual visit documentation will look like in the patient chart. Code visit. This will open up the code visit window to allow the provider to enter in their level of care for the visit. Repeat. If a query has been built to document multiple instances of an issue or problem, selecting the Repeat button will highlight it on that multiple query will automatically repeat the query in the next sequence. An example of use for this could be if the patient has 2 lesions, the physician wants precise documentation for both lesions and wants to differentiate between lesion 1 and lesion 2. They can use the repeat functionality to perform this action. Save in process will save the note as in an in-process status. This means that the user can go back to the template and add or remove documentation if needed. And cancel and save. If cancel is selected prior to the note being saved, the whole template will be canceled. If the template has been saved and the user enters documentation and cancels, the additional documentation will be canceled, but the original documentation would stay intact. Selecting the Save button provides several different options for the template. We can save in process or select one of the following. Draft only allows the addition of documentation. The user would be unable to remove any documents, anything that had been documented. Signed will sign and finalize the note template. If anything was to be added, it would become an addendum. Canceled is used to totally cancel the note, but can only be used and is only available if the note has not yet been signed by the provider. We'll talk a little bit about CPOE, or Computerized Physician Order Entry, and how that's performed in NPM. You can access the Orders module from the table of contents, but we'll be demonstrating the Orders workflow through our documentation of our patient visit and how it would be done by the provider during the visit. Once the provider was in the plan section, they could begin entering orders. Best practice is to add problems prior to adding orders. By adding our problems first, the ordering process will be a little less cumbersome. Once we click the Add Problems button, the Problems window will open. We type in the search bar to find our problem and either click the magnifying glass or the Enter key of the keyboard, and then check the box next to the appropriate diagnosis. Once all appropriate diagnoses for the encounter have been selected, click Save. This will bring us back to our plan, where we would then click the Add Orders button. Once we click Add Orders, the ambulatory order management screen will open. At the top of the screen, you'll see any current prescription and diagnostic testing that's already been ordered for the patient. This allows the provider to easily access the patient's current orders to avoid duplicate ordering. However, a patient with multiple medications could take up a great amount of ordering workspace. So best practice would be, once the provider's reviewed the orders that are currently up there, is to minimize the current ambulatory orders to enable a larger workspace to enter in today's visit orders. Often, especially like during training in the first few days of a go-live, I try to constantly remind providers about that minimize button. When you're looking at a patient that has 20 or 30 medications, that takes up a lot of space. So this ordering area gets pushed down, and you end up having to do a lot of scrolling to finally begin to enter in your orders. And what does that end up being? That ends up being extra clicks or extra things that your providers don't want to have to deal with. So we click that minimize button, and we can go right to order a diagnostic test, which we're going to do now. We'll click that orders button. If we happen to have any favorites saved, the system would default to our favorites. Otherwise, we can search by the name functionality. We're going to type in a few characters to search for our order, check the box next to the correct order, and then enter in any required information. If this is the only item we needed to order for the patient, we could click the select button. However, in this case, we're also going to order a medication. To order a medication, we just click the Meds button, and as with orders, if there are any favorites saved, the system would default to our favorites. Otherwise, we'll search for the medication by name. We click the plus sign next to the medication name to open the available options, and then check the box with the appropriate dosing. Best practice here is to click the Details column to open the Change Details window. This will assist with easier editing access. I found, especially for older docs, the ordering area here can be a little bit messy and jumbled. whereas the change details window is much easier and neater. It's easier to see. You can also associate your diagnosis with the medication being ordered so that it falls under the correct diagnosis in the plan. Once the medication stick has been entered, click Save. Excuse me for just a moment while I take a drink. To order, once all orders have been completed, we'll click Save. DUR or drug utilization review will occur, and if there are any interactions or allergies, an alert will pop up. If open, if necessary, enter in the preferred pharmacy. Most likely this has already been done by support staff. And clicking Save will not only send the medications to the pharmacy, it will also enter any orders for diagnostics into the system, and it will also trigger any system-generated task. Clicking Save will also bring us back to the plan section of our notes. Now, as you can see, our orders are now under the diagnoses that were associated with them. We've also free-texted a little bit of documentation into our plan under each diagnosis. In addition to free text, we can also use Dragon, as Kim had mentioned earlier, and we can also use the Get Text functionality, which opens a Get Text window. This allows access to the canned text documentation. We search for the appropriate text for our plan, click the box next to the text we wish to use, and then we have the ability to edit and personalize to our patient as needed. Once any editing is completed, we can click OK, and we'll be brought back to our plan. The next part of our physician workflow, physician visit workflow, is coding the visit. There are actually two ways that provider can code the visit. It can be completed from within the note or by using the coding worklist button that's located on the Schedule desktop. First, we'll discuss coding the visit from within the note. The provider would need to click the Code Visit button, and the Code Visit window will open. They'll review the code levels determined by the EM coder based on their documentation. Keep in mind that the coder does not pick up free text, so the level of care substantiated may be different than the actual level of care. So this would slide into making any changes as needed, as ultimately the decision-making is performed by the provider. So as a provider, if I knew, in addition to my clicking that I had done, that I had some free text that actually brought my history to detail and my exam to detail, and my decision-making on this was actually kind of a moderate complexity, I might not agree with the coder that I'm just getting a level 3 on this visit. I might feel that a level 4 is more appropriate. So I would then select my level of care and click OK. Clicking OK will bring me back to my note, and if my documentation is completed, I could then sign off, and if not, save it in process. Once I saved in process, I could click on Record List and be brought back to my schedule. While we're at the practice schedule screen, and before I get into the second way to code, which you can see we do have our little coding worklist button down here, I wanted to bring up a question that occurs frequently, most often during the first few days of the go live. Almost every single provider asks, how do I know if I've signed all my notes? Well, there are two ways. First, on the physician schedule, there is a column with the header of document. Within this column, we'll show the statuses of the notes as either in process or signed. For mid-levels that need co-signs, you will see an I signed status as well, and it would stay in that status until the co-sign had been completed. Secondly, they'll have an incomplete document task if the note is unsigned. When the task is opened, it provides the unsigned document information and a process task button, which would bring them to the template that needs signature. And right behind that, how do I know if I signed my note question, I get, well, if I signed my note and forgotten to code, how do I code my visit? As I mentioned earlier, there is that little coding worklist button, and once that's clicked, the Code Visit Worklist window will open up. Excuse me. And we'll show the appointments to the session, whether they were processed during the visit using the EM coder, as well as any additional codes that are associated with the visit. Now, some providers actually prefer coding this way, because in addition to entering their level of care for the visit, they can also see whatever CPT codes from either test or med admins have brought from the visit. They can also code all patients at once, which again can be a preference for some. So once the provider has coded their visit, their part is done. So what I'm going to do now is hand things over to Kim so that she can finish up our patient visit process. Whoops, and let's sister with any ambulatory tasks that need to be completed.
All right. So from here, normally when the physician gets to this point, it's turned back over to the support staff for things. And, you know, I mentioned that they can put that they've seen the patient, but they didn't put that they departed. So here, the staff can go back to the desktop and check to see if there's any tasks that need to be completed before the patient leaves. We're going to look at just two of examples of how to complete those. And I just want everybody to stop for a second, take a deep breath, stand up, stretch. We're almost done. I know this is dry, and I know that it's been a long time and it's Friday afternoon, but I appreciate you listening, and we're almost there. So for the desktop, you go back to your desktop, and then you've got your list of items here. These are under the orders section, and it depends on the workflow for your office as to who will look at this. So we're going to look at one that could be a front desk staff or a back office, depending on how you have it set up, and one that's normally going to be for your lab or your nursing staff. And the first one is the follow-up appointment. We highlight follow-up appointment, and it opens the task window. And as you see here, it gives us a little bit of information for the patient contact, if you're going to email them, and you know, if there's other methods, it'll be showing up there. And then it gives you the follow-up appointment when the provider wants them to be seen, and if the default location is going to be whatever location that provider's in, but if he wants them to be seen elsewhere in 2 months, maybe his satellite office, then when he places that order, he can change that so that you know where. Once you're ready to satisfy this task, you would click Process Task. If you don't want to satisfy this task right now, and you want to go back to something, then you can go to the list, and it'll take you back to that task list. The next thing is we clicked Process Task. So we click Process Task, and if you notice, there are 3 tasks on this patient that are outstanding. Over here, it explains this action that's needed for these tasks. So for this strip, they need to have results entered. For glucose, order management is incomplete. That means that there is something missing. Maybe this is a question that's saying, is the patient fasting? And we're going to look at that in a minute. And then down here is our follow-up appointment. So if this is the only one we want to work on, we click on this yellow detail that says Verify, and it'll bring us to another screen. It'll actually change that to complete. Now, again, you might have a question tied to this that you can put in when the patient's scheduled to show that you did it. This particular system is set up that once you verify this appointment has been made, it automatically goes to a complete status. Then you can click List and go back to your list, like we did here. So now we're going to look at Checkout Ambulatory Order. A Checkout Ambulatory Order means basically what it is. It's an order that's in place, and something needs to be done before it can be completed or finalized. So as we saw earlier, on this particular patient, the previous patient, it showed OM incomplete. Well, that meant there was order management. There was something missing. It might have been where the service needed to be performed. Here, it's giving us a required queries. So it's missing ask and order entry questions have not been answered. In this instance, it's the source. So we put the source in here, and then it changes it to a process. Now, if this is something that's going out, it might just sit there until the interface results come back in. If this is something that is being resulted by your office, this probably will be moved into this incomplete order up here and be an incomplete because it's pending results to be entered. Then after that, we want to check the patient out. Now, again, depending on your workflow, if you're set up in a pod type situation at the back and maybe your patient goes to a particular person in the back to check out, or if they go back to the front desk, it'll depend on your workflow and where this checkout process will happen. This is looking at the provider workflow, and we're actually in the patient's chart. We're looking at the patient summary. And here at the patient summary, you can see in the chart there's a button that says check out. Okay? Apologize for that. It's not working. If you are in the scheduler workflow, this is not working correctly. I apologize for that. Then you will go to the checkout and check in and out, and it will bring up another window for you. But from the back end, you click the checkout, and it'll bring you to an encounter window. So if this patient has more than one encounter that hasn't been completed and checked out, the patient departed, that's why you get this big old long list. If the patient only has today's visit, it'll be easy to sort through. You just pick the day's visit and click OK, and it'll take you to this screen. This screen gives you the capability of the documentation that's needed for this visit. So we've got a visit summary up there that's automatically checked. Good deal. We're going to do a visit summary on this patient. Then we've got footer buttons down at the bottom. We have new practice appointments, which will launch a different window. We'll look at that briefly. A new hospital appointment, which means if you are booking for someone somewhere else within the facility, if you have that security and that capability of doing that, then it'll launch you into the hospital side and let you book those appointments accordingly there. Add patient education. If you need to add some patient education to this to print, then you can do so. Maybe the patient says, do you have anything on XYZ procedure they're going to do for me? You can add that to it. Then we have future appointments and cash drawer. So it depends on your role or what your functionality and your workflow is. You might, have to add items in this area. Send to portal. On this particular, if the patient is a patient portal and they have requested that their summaries and education go to the portal for them to look at later, then you will, if this patient had a portal, was assigned to the portal, signed up for that, then you can click patient portal, and instead of printing, it'll go to the portal. But then you have your print function here, print and depart, or depart patient. So print, of course, is going to print anything you've got checked. Print and depart means it'll print and automatically depart that patient to complete that visit. So it's going to change that status to departed. Or if you send it to the portal and all you need to do is depart the patient, then you've got the depart patient. So we were talking about the new practice appointment. This is a little screenshot of the screen you'll get. And then once you pick the practice and appointment type, it launches you into the appointment schedule. This is a look of adding patient education. So it brings up a second window here, and you can search for the education. So our male patient Mesny test is actually going to get some patient education on false labor. And as you see, it's added and checked. So when I get ready to print, it will print for me, and it gives me a box that asks me where you want to print it, either your local printer or it'll look at network printers. It automatically will default to what you have defaulted. But if you notice, it's also got a preview here. That will let you preview what you're printing to look at it first, and then within that preview screen, it's kind of like a PDF viewer. You can print to your local printer that way. This brings us to our conclusion of our webcast on Meditech MPN 101. So we're going to look at the Q&A panel to see if we've got any questions, and we'll leave it open for a few moments while we go through some of our questions. I want to remind you that our handouts from today's presentation, along with any Q&A, will be available on the Galen Wiki within the next few days. And Sue, do we have any questions?
Yeah, it looks like we do have a couple of questions that have come in, Kim. First one.
Huh? I was going to ask, can I do a poll right quick?
Sure, yeah, go right ahead.
All right, let me see here. I'm going to open up the poll. Right now, if you guys could just say, how many of you are on MPM or Meditech? You could just answer that for me. And then the second question is, if you are, what version are you on?
All right, well, folks are answering on that poll question. We can get through a couple of the questions that we've received. First question that we got, you warned us against using the cut and copy function, causing issues with different providers. Can it be assumed that there would be no issues when using that functionality for the same provider? And I would say that question is for you, Kim.
Yeah, so like I said, you just need to be very cautious because you really don't want your providers getting into the situation where they can't sign off on their orders or they can't sign off on their notes. So using that cut, copy, paste, use it kind of cautiously. The transfer is a good, but best practice, we all know, is going to be to cancel that appointment. It'll pop up a window and let you put the reason you're canceling it, and it'll document in the record for any questions of anybody looking back on this in the future, and then it'll let you reschedule. So it's great to have those little shortcut keys there, but best practice is to do it the old-fashioned way, cancel it and reschedule it.
Okay. That answers that one. Next question. If you open the wrong template or duplicate template, is there a way to cancel or void that incorrect one? Yes, there is. A couple of depends if, though. If the note is unsigned, if the template's unsigned, the cancel radio button can be selected. But in the event that a document that has been signed needs to be canceled, first thing, the cancel button will be unavailable. But what you can do is check in with your NPM clinical analyst, who does have the ability on the back end to go through the RAD transcriptionist desktop, where they can unsign the document and then change the status to canceled. And I see one more question coming in, I think. When signing orders or documents, is there a way to skip an order, or do you have to stop and start over again? Oh, yes, I actually should have shown that. In the upper toolbar, in the order processing screen, between the pen icon and the stop sign icon, there are two arrows, and they are blue when there's something to either skip over to or go back to. If there's nothing to go back to or nothing to skip forward to, then they would be grayed out. And that looks like that's it for questions. We will, actually, Kim, did you get anything back on your poll question?
Yes, it looks like, I'm sorry, I closed that window in case we needed to show some screens. Let me open that back up. It looks like...
Kim, I think when you closed the window, it might have shut down the poll, actually.
Yeah, it did. It did. But when I remember from looking at it, we have a few people that are already using NPM, and I will have to look back on that and see what version they're using. So we want to thank you for joining us on your Friday. We appreciate it. We are giving you back a few minutes of your time. Woohoo! But if you have anything that you'd like to have us review with you, or any other questions, or would like to talk to us about assistance with anything, please go to our Galen website, click on the company item at the top right of the screen, and click on Contact Us, and we will be more than happy to reach out to you and try to help you with anything you have. Thank you.
We'll keep the Q&A panel open for a few more moments. Otherwise, everyone have a fantastic weekend. And again, thank you so much for your time.